Good afternoon and welcome everyone. I hope you're having a great day on this Wednesday. Welcome to the How Psychological Health and Safety is Transforming HR and Safety Strategy. We are so honored to have Dr. Olga Morawczynski with us to talk about PHS. My name's Eric Gislason. I'm the Executive Director and CEO of the NASP, who's sponsoring this meeting. A couple of quick housekeeping items before we get started. I want to keep this as informal as possible, and there will be opportunities to ask questions. Just put those in the chat. Probably won't be interrupting the presentation to address those until the end, but we're going to give ourselves plenty of time at the end to address those Q&A. And if you don't get your question answered, we will definitely follow up with you if you have some specific questions that we didn't get an opportunity to discuss. We'll also have a couple of polls throughout the presentation. The polls are not formal. Just put your answers in the chat box and we'll kind of anecdotally talk about some of the things that you respond to as far as where you are in the PHS journey. Speaking of the PHS journey, just a little bit of an introduction to my journey with PHS. I've actually been in safety for over 30 years now. So from the beginning, let's face it, I was compliance driven like most safety professionals. My thought process was, hey, if you had good plans and programs, you had good training, good inspections, then you're going to have a safe workplace. And does that help? Yes. Is that the framework for a safe workplace? Sure. But I think all of us know these days that that's just the skeleton. That's just the beginning, the foundation of a safe workplace. And as I progressed in my journey in safety, I've looked at a lot of the human factors aspects of it. So I really got into HOP, human and organizational performance, and saw, wow, that really opened my eyes to the fact that the concept of name, blame, shame, and retrain doesn't really work anymore, right? We should use our employees as a resource and understand that they have solutions to the problems, that they're not the problems. So that aspect was a real eye-opener to me. And actually seeing that implemented in sites and working and driving down injuries was very, very encouraging to me. Then fast forward to about 3 or 4 years ago, I heard the concept of PHS, and I really started reading into it, and my mind was blown. This was a whole new science of safety that I hadn't really been exposed to. And my thought process was twofold on it. I thought, this is great from an academia perspective, but, I'm not sure whether or not it can be applied practically in the workplace. Because if you guys are like me and safety managers or safety professionals, we wear a lot of hats already. Just getting people to wear their PPE. Are they going to come to your safety committee meetings? Are they going to do inspections? Are they going to report conditions, at-risk behaviors? Are we going to get management commitment, employee involvement, set up a safety management system, cultivate an organizational culture that emphasizes safety? All these things that we have. And then you've got this concept of psychological health and safety. Okay, one more thing for us to deal with. So I was skeptical because, I'm not a psychologist. I'm not a psychiatrist. I know people have stress at work. So what do we do about it? And as I continued my research, I came across Dr. Morawczynski's website, and I thought, wow, this is somebody who really gets it and understands to take these concepts and apply them to real practical world applications. So I reached out to Olga myself. And fast forward, she's now one of our lead consultants on PHS, does a lot of training for us. And I thought it was really important for us as an organization to really highlight this. So that's why we're having this webinar. So with that, I'm going to turn it over to Dr. Morawczynski. Olga?
Thank you, Eric. So does that mean you're a convert now?
I think you've converted me, yes.
I just wanted to hear that. Thank you, everyone, and welcome. And just to give you kind of a little bit of background on me before I fill you with information, I spent the last few years really deep in the research around this space because we really wanted to understand some of the key impacts of psychological health and safety on employers, especially on their business objectives and their outcomes and KPIs. But I've also worked with a lot of organizations. So everything we've learned out of that research, we've had the opportunity to begin to apply, whether that's in a training, whether that's in actually going in and doing a full psychological health and safety assessment, which we'll talk about later. But that's really the beauty, and that's really where we're starting to see some pretty incredible impact. And I really would also love to hear from you if you've already done this type of work. And I think I'll be calling on a couple of people to see how this is showing up in your business today. Oh, let me just kind of move forward. But before we kind of dive in, one of the things I'm going to encourage you to do is really use the chat. I'm not able to really see it, but I know Eric and the rest of the team can, because I want to get your feedback. I know I can't speak to all of you today. So the first question I have for you, and please put it into the chat, is how knowledgeable you are about psychological health and safety. So are you an expert? Are you implementing, ISO 45003? Can you talk about this kind of stuff in your sleep? Have you heard of it, but you're still trying to understand exactly what it is and how it works? Or are you completely new? So if you can just go to the chat and just answer whether you're an expert, familiar, or new to it. And maybe Eric, if you can just give us a sense as to what's coming in.
Yeah, I can definitely tell you it is a vast majority of B and C. So
Okay.
not a lot of experts in this crowd. In fact, more C's that are just really new to it. So
Okay.
kind of gives us an idea of the, and man, that thing is blowing up. So I was,
Awesome.
From that perspective, Olga, I would say maybe a good starting point, since we've heard that term PHS, but
Yeah.
what really is psychological health and safety? Is it different than physical safety? Maybe you can tell us what it is.
Okay, well, let's start here, given the fact that we have audiences with different backgrounds. But psychological health and safety, or PHS, you'll hear us saying that a lot, refers to the state of protecting and promoting employees' mental well-being. I'll talk to you about why that's so important in a minute, and I'll show you kind of some key numbers. And really, we do that by identifying and managing something we call psychosocial hazards. Now, this is really important. I promise you, this is the only kind of key terminology that you have to remember. And a psychosocial hazard is any aspect of work that has the potential to cause injury or harm, whether that's a physical injury. So that could be a slip, or it could be a burn. It could result in a broken arm or something else, or something called psychological harm. Now, this is the term that's starting to crop up. And psychological harm is something that happens at work that can result in either a mental health challenge or a mental illness, right? So that could be something like PTSD, right? You witness something horrific at work, and then you eventually have a pretty serious diagnosis. It could also mean anxiety. So you have chronic workload and you're overwhelmed. And that anxiety is really impacting eventually your ability to function or to enjoy daily life. It could also mean depression, which we often see the result of bullying. So I just want you to picture the fact that there's both the physical elements to these psychosocial hazards, but there's also the psychological element as well. And as workplaces, we can cause harm, but we can also help to reduce it. I mean, there's such an opportunity here for prevention as a safety professional, and we'll talk a little bit more about what that actually means and what it looks like. Now, we were really interested in really exploring what factors are actually implementing mental health at work. So, we don't do anything small. We looked at over 1 million reviews on Glassdoor and Indeed. So that's a place where people go and essentially complain, or sometimes they say great things about their employer. And what we wanted to know is, what are these people talking about? And this is kind of the top thing. So these are psychosocial hazards, by the way, right? Leadership, often poor leadership, compensation, pay and benefits, working hours, often too much work or too long hours, inadequate resources, a lot of lack of training came up, right? Bad culture, which actually came up lower than I thought. But just to say, there's very specific things that we see coming up, not only in the data, but when we go and do these assessments and implement programming time and time again. And often we really like to look for these key factors, psychosocial hazards, when we're doing these assessments. And this is my favorite quote that I saw come up in a mental health kind of study. By the way, my husband doesn't believe this, but your boss has more impact on your mental health than your spouse or your therapist, right? I just found this so interesting, but we do spend half of our life at work, and a lot of us are so tied to our jobs, our purpose, it's really important. So that environment is so critical for our own mental health and well-being. One more thing I'll just say very quickly, we did a piece of research a few years ago where we interviewed a lot of people who had and surveyed a lot of people who had gone on mental health leave. 80% of those people said that work was either the primary cause of their mental health issue or had exacerbated a pre-existing issue that they had. It made it worse, right? So what I wanted to do is just emphasize that there's such a connection between our mental health and well-being and the environment in which we're in. I'm probably totally stating the obvious, but I think it's something that more and more we need to really start talking about and really integrating into the work that we do. So
Olga, I have a quick question for you.
Yeah, tell me.
So I saw your bar graph with the worker compensation, not workers' comp, but being paid adequately and long hours. And I think that I think most people could agree that, yes, I'm overworked and underpaid, but I was surprised to see the leadership aspect of it the highest. What do we mean specifically on leadership? When you say poor leadership, what do you mean by that, and what do we do about it?
Yeah, well, it really changes depending on the organization and the leader, right? So when we actually went in and really started to read these reviews, right, it came around demanding leaders or leaders that weren't really forthcoming about the changes happening within organizations that left teams stressed and confused. Leaders that didn't adequately divide up work, right? And people just weren't feeling, they were feeling a little bit overwhelmed. It really depends, right? And I think the first thing you can do about it is figure out why people are not happy with leadership. And I know, and sometimes you do see common themes coming up and up again, but all leaders are humans and all humans lead differently. So I do think there can also be very specific and targeted interventions for leaders to more effectively guide their teams. And that can simply come with training, right? And if you think about it, a lot of people kind of get into leadership positions without ever having that type of formal training of how to be a leader, right? So they're sometimes doing things without even recognizing that they might be not only causing harm, but not maybe bringing out the best in their people. Does that resonate as a leader, Eric?
It does. And what I see in a lot of organizations, to your point, is that leaders who rise up through the ranks, maybe make supervisor, line management, manager, that's typically because you're effective at production. You're effective at, getting stuff out the door. And we lose a lot with soft skill development, right? Empathy, communication skills, things like that. I see that as a weak point in a lot of organizations.
So do you think you have more influence on your people than their spouses or therapists?
Well, I hope not.
You hope not. We'll ask John later what he thinks.
Yeah, exactly.
Okay. So what I'd love to know now is how you're seeing some of these psychosocial hazards show up in your job. So if you can just, if there's one on this list that really seems to resonate with you, or if there's something else, right, that we haven't included that you really think is impacting the mental health and well-being of either you or some of your colleagues or even leadership, let us know. So it could be anything from demands of work, the actual physical work environment, remote or isolated work, job security, change management. There's lots, but these are typically the ones that we see coming up quite a bit. So Eric, I'm curious to see what's coming up in the chat.
I'm seeing a lot of job demands.
Okay.
I'm also seeing abusive leadership.
Okay.
Some physical work environment, but I'm seeing a lot with leadership and job demands.
Okay.
And I see somebody that said 1, 2, 6, and 7.
All of the above, maybe.
All of the above.
In some cases. Okay. Well, I
And
mean, the good news is often
go ahead.
the first step of addressing some of these challenges is understanding what they are, right? And we'll kind of get into that process in a little bit. But I just want to say that we see often a lot of these showing up, the same ones showing up time and time again within organizations. But we've also seen organizations do the work to really manage their impact.
So from that perspective, it goes back to my initial lead in. We all experience stress on the job. Are there trends that show that people are suffering more from mental illness? I mean, you look at, my gosh, you think about the Industrial Revolution and you think about how rough and harsh conditions were back then. I don't think people complained about it. So I don't know if it's becoming more well-known because people are more prone to speak about it, but do you have any information on trends or anything like that?
Yeah, so we've identified three major ones that I think are pushing a lot of leaders to focus in this area, and I think the first one is really the deterioration of mental health. I think we're still trying to get a sense as to what COVID did to our mental health and well-being, but any report that you will read now on mental health is showing that there's, and even still now in many cases, that there is an increase in mental illness, that there's an increase in stress, anxiety, and burnout. But just to give you kind of our current state, so about 1 in 2 Americans now frequently experience high levels of stress. 1 in 2 will be diagnosed with a mental illness. Now, let me be clear on the difference, right? A mental illness is a diagnosable condition that really impacts your life. It's not like I'm stressed today or, I'm anxious because I have this presentation. It is consistent and it requires treatment, right? So generalized anxiety disorder, addiction, and alcoholism. There's kind of a whole list of mental illnesses that are diagnosed, and these are serious, right? And as I'll show you in a minute, they impact how people show up for work. And 1 in 6 experience a substance use disorder. So these numbers are climbing up and up and up. But where we're seeing the biggest impact is among young people. So 1 in 2 say they experience persistent feelings of sadness or hopelessness, and there's tons of right now research being done as to why and what's going on and how media and social media and everything is impacting it. But what is devastating to me is 1 in 5 have attempted suicide in the last year. Now, the reason I am bringing this up is because this is the future of your workforce, right? These are people coming in. It's not like the COVID happened, we've got some mental health stuff and it's going to go away because the world has normalized. That is not what's happening, right? Especially with these younger segments. We're even seeing here with these younger segments that they have some of the highest rates of disability claims, right? It's the young people, not the older people, right? When it comes to mental health related disability claims. So I just want to say that this is not a problem that is going away anytime soon, which is why we're seeing many leaders suddenly talk about mental health and well-being.
Olga, one other note on that suicide aspect. Well, quick question on the suicide. When you're saying the younger, do you happen to know what the age range is on that?
Yeah, so for that, that was I think it was between 13 and 25. So they were looking at that generation just starting to enter the workforce or who have just entered the workforce.
What's interesting, at least in the United States, is the increase in suicide with our construction workers and with former military. And these are also people that are entering the workforce from military assignments and that sort of thing that have a lot of the PTSD aspects and things like that. So,
absolutely.
I mean, think about it. That's with that younger population, that's 50% that are experiencing, and then 20% that have actually attempted suicide. That's insane to me.
Yeah, I mean, it's devastating. I don't know what that's going to look like over the next few years, but I think it's going to push a lot of changes in not only how we do support mental health and our benefits, but also at work, right? Which is why it's so important to start already building those conducive environments for mental health and well-being. And by the way, one more thing I'll just say on this population, they're also forcing change, right? They will turn down jobs that do not have a good work environment, that do not have good mental health benefits, and that do not allow space for talking about mental health and well-being. So I actually have a lot of respect for these young people.
One more quick one, because I just can't, I can't pass up the opportunity to throw this out. And this is by one of the people in the class. What are your thoughts on this? And they ask, on the metrics between young versus old, would it be influenced by the generational mindset? The younger workers are softer and less seasoned in terms of life experiences. They are fragile rather than robust. What do you think about that?
Maybe to some extent, but I'll tell you something else that's happened over the past, especially 5 years. We are seeing so much more open conversation around mental health and well-being. Young people have not only listened to that, they've been a huge part of that. If you look at TikTok, or I'm not on TikTok that often, but I do have an 11-year-old who is, right? If you're on TikTok, or if you're on any social media, there's a lot of discussion on mental health, right? And they talk about it so openly. So I don't know if they're softer. I just think they're more forthcoming with what it is, because it's just more so, it's more acceptable right now, I think, to talk about mental health and mental illness.
It's fair.
All right. So second trend, we're seeing this is impacting. So everything that's happening is impacting if people show up for work, right? We're seeing a huge increase in the number of sick days. This is between, I think, 2019 and 2023. But I read other reports about 30% per year increase in the number of mental health related sick days. Now, I know it's hard to always tell why people aren't coming to work. I know some organizations have implemented mental health days, but what we're seeing is that this is really starting to go up. The other thing that's starting to go up as well, if I can just move on, is, and here we know, is really kind of mental health related disability claims. Now, we look at a lot of insurance data, and if you see the blue line up here, these are mental, what they call mental disorders. So these are the proportion of long-term disability claims, which are the result of mental illness, right? And you'll see the numbers going up, but you'll also see it's way higher than anything else here. So if you don't believe this research, look at your insurance data, because I can tell you if they're collecting insights around psychological injuries or mental disorders and they're aligning it to LTD claims, we are seeing this kind of go up everywhere. And right now we're seeing that 40%, and I've seen up to half, are related to mental health. And this is North American data. So we see a lot of this showing up. So because of what's happening, your people are not showing up to work. And we're seeing increasingly that this is becoming an issue. The other thing that we're seeing, which is probably really relevant as well to you, is we're seeing an increase in workplace injuries because of mental health. So in one study, they found that 40% of organizations reported an uptick in safety incidents, near misses, and they attributed that to mental distress. And then another one with employees found that what they called impairment, whether that's stress, burnout, or alcohol or drug use, was affecting safety in their workplace, right? So they saw this going on around them. And this is also a statistic. It's probably 2 years old now, but I just think it's so devastating. So right now we know that workplace stress causes 120,000 deaths in the US each year. It's probably higher by now.
Real quick on that one. I saw that statistic when you and I were teaching that class in Texas. Yeah. And I thought, that can't be right. Because if you look at OSHA, and OSHA says, well, there's about 5,300, give or take, a year that die on the job. Of course, I understand that those are injuries and not illnesses. But then when you kind of peel the onion on that, Olga, I mean, it's absolutely the concept of stress being the silent killer, right? We think heart disease and strokes and heart attacks and even obesity and diabetes, all these, the top 5 killers in the United States, a lot of them are stress induced, which we can attribute back to the workplace. That's scary.
It is scary. And also to say, I don't think we have a good picture as to what that number actually is, because we're not collecting that data today, right? So we've got that 120,000. But if we were really to dig into some of our numbers, even some of the incident or fatality rates, and we really looked at what was going on the last 2-3 months, right before the incident, I'm sure we could see much higher numbers than that. And we'll start to see that, I think, over the next few years. Better data collection, I mean.
Yes.
All right, so for the next poll, I'm just curious as to what you're seeing in your workplace show up, right? Are you seeing deterioration? Are you seeing it impact if people show up for work? Are you seeing more sick days? Is it causing a rise in workplace injuries? Is there something else that you're seeing related to mental health and well-being? Eric, over to you as to what's showing up.
Yeah, it's all of the above, 2s, 3. I mean, I think it's yes, all of the above.
All right. Perfect. Okay, then we're not the only ones seeing this.
So from that perspective, we obviously know it's a problem, right? How do we present that? In other words, how do we take that to management and say, this is something that needs to be handled? What do we do?
Yeah, so we did start to look at psychological health and safety and how it can impact your KPIs, right? So if you are approaching your manager, and we'll talk later about if you are approaching kind of leadership outside of your safety team to really do this type of work, but if you are approaching your manager, I mean, you name it, I think we could probably make a connection between a lot of your major KPIs, whether it's TRIR, near misses. We're also seeing workers' compensation costs. By the way, I speak to a lot of workers' compensation bureau. They are increasing. We're seeing up to, double from 5 years ago, because if they are tracking psychological injuries up to 5 years ago, that number has doubled, right? So what you're paying as a premium is going through the roof. So we'll talk about, I'm going to actually call on somebody in a minute to talk a little bit more about this, but I just want to show here that there are very clear indicators that are being impacted by the mental health and well-being of your workforce. Does this make sense, Eric?
It does. It does. And, that's what, that's where you get into is it a safety issue? Is it an HR issue? Because the chat is blowing up with these types of comments. But if we're talking TRIR or some of the other lagging indicators that we can show improvement, then, I mean, that's a win, right? And workers' comp claims and premiums, I mean, we don't want it to be about that. We want it to be about the workers' safety and morale. But the reality of it is if, we go to management, we have to make that case.
Absolutely. Yeah. And I do also want to say, especially because what I said earlier about young people, this is only going to grow. So the more time that goes on, if we don't start to pay attention to this, I think it's going to have more and more of an impact on our KPIs. And by the way, not just your KPIs, we can organizationally, I mean, we work with a lot of HR professionals as well. So things like absenteeism, turnover, disability claims, a lot of their KPIs are also being impacted, right? I can go through your entire organization layer by layer and tell you which KPI is being impacted if you are not focusing effectively on psychological health and safety. Now, this is why it's so important to think about psychological health and safety, right? Because if you think about, I mean, we can't equally and easily divide a person into two, but there's what happens at work and there's what happens outside of work, right? You can't necessarily control what's happening outside of work. What you can do is you can provide good benefits and EAPs and other, really great support mechanisms. But where you as an employer have more control is what happens within your workplace, right? So I think really to not have this impact on your organization as mental health continues to deteriorate, you really need to figure out how to adapt psychological health and safety and really institutionalize it. And we will talk about what that means a little bit later. And the other thing, we named this webinar, we talked about the future. I honestly believe, and I'll also have Eric and maybe somebody else who's a safety expert can come in and say that this will be such a critical part of safety professionals' focus over the next 5, 10, 20 years, that if you position yourself as being very well versed, you can not only have an impact, I think, on your own organization, but also on the whole industry and how we start to evolve. Because right now it is so critical. And I'm curious to hear from you, Eric, what you think about this.
From the perspective of
how important is PHS if you are a safety professional for your future trajectory?
I think that it is the next chapter. I truly do, because I'm hoping that most of us, and not all of us, but most of us have gotten a handle on the compliance aspect of it. We know what we need to do. We know what our employees need to know, but we haven't gathered what's really causing these at-risk behaviors. We know people don't go into work thinking, I want to get hurt, right? But the things that are on their mind, you're talking complacency, distraction, fatigue, rushing, all these other states of mind that we talk about. What drives that? It tends to be these psychological stressors.
Absolutely. And I'm actually going to call on somebody in the audience. Ergan Abash, are you there by any chance? There you are.
Yes.
Okay. So I just wanted to.
This has been great so far.
Yeah, thank you. And sorry to just call on you like this, but I know you are such an advocate of the space as a safety professional. And I know we've talked a lot about this. So I'd love to kind of, go through and ask you a couple of questions, but maybe I'll give a chance for you to introduce yourself first.
Yeah, absolutely, Olga. Thank you. My name is Ergan. I'm EHS manager with one of the largest utilities in the US, and I've been doing management systems over 10 years, but in the last 4 or 5 years, I've been focusing on EHS management systems that is based on 45001 standard and 14001 standard. So really enjoy the work that I do and the difference that I make. And of course, like Eric said, this is the next phase of that journey. So I'd be more than happy to share some of our experiences as far as the PHS work is concerned.
Well, maybe why don't we just kick off and asking why your organization made the decision to implement PHS? Because I know it was driven organizationally, and then it came down to you. So can you tell me a bit more about that?
Absolutely. I think, Olga, it's a personal passion for me, but sometimes the personal passion doesn't go a long way. We talked a lot about leadership on this call, probably at length at that different level. But for us, there are a few factors, and it started with the leadership commitment, right? So we have leaders that truly care. And as I mentioned, our ISO 45001 based system, we've had that in place since 2016. Started with the OSAS standard, of course. But we truly care about our employees' mental well-being as well as emotional well-being. So, getting that leadership commitment was really the kind of the foundational aspect of it. And I also mentioned the environmental. That's probably a separate topic, but just building up on the 45001 and adding 45003 just felt like a natural fit. And also we had the support of our parent company. So that was a huge, when the mothership says go, there's no questions asked. So in addition to our leadership support, our parent company is behind us as well. So, we have their support. And then for me, I think hopefully I'm not repeating a lot of the things you're saying, but when people feel safe to speak up, when they take breaks, when they report concerns in a psychological safe environment, it really reduces the risk for the organization. Of course, to protect that individual, right? Even if there is an incident, the severity goes down, but we're looking to foster more resilient, engaged workforce that are happier, that are more engaged, and for the benefit of the company, more productive ultimately.
Mm-hmm. And what about you as a safety manager? What KPIs do you see changing as a result of effective implementation of PHS?
Yeah, I think like at the risk of repeating what you already said, like TRIR last time, those are traditional KPIs, right? And I know some of the people on this call, they can resonate with this. We are some of the organizations are moving from lagging indicators to leading indicators, and I think Eric talked a lot about HOP and the HECA world. So with those, I think focusing on leading indicators is the right direction, and where the PHS comes into play, it helps us to get there faster. And you shared a lot of data as far as if you have happier workforce, if you are if you have people who are engaged. I'll give you a quick example. Earlier in my career, we had a safety incident. If you ask me what the incident was, I probably don't remember it. It was probably like a finger incident where employee got a hand injury. But when we did the investigation and when we start peeling that onion, he started talking about he had a kitchen fire that morning. He has like a 6-month-old baby that didn't sleep all night. He brought that to work, and he couldn't take off from work. He still came to work. He was distracted, and this incident happened. And then traditional safety incidents could say, "You messed up. You're fired. Out of here." Type of deal. But if we really understand psychosocial risk and what's happening to humans as a whole being and what they bring to work and how we can help them as an organization, it's a win-win.
I love that. I love that. And what about your own future trajectory as a safety professional? I know you've been working on this for a while, and I love talking to you, again, because you're so knowledgeable about the space, right? And I know you're in the midst of it right now, but when you think about how this will impact the type of work that you do in the future, what does that look like?
Yeah, I'm going to repeat what Eric said, right? This is I truly think this is the future of safety, and it's not like the flavor of the month. And probably with the safety management systems, it's the same thing. HOP is the same thing. It's not going to happen overnight. It's going to take time for us to implement, but I think that it's foundational. And as I mentioned, when people are heard, respected, and when there's an environment that they can be trusted, they're going to treat your business as if they're own LLC. Like let's say like Olga's LLC. You're gonna work harder. You're gonna be happier. The turnover rate is gonna go down. So for me, as I mentioned before, this was a personal passion, but having that leadership support behind me and being able to have the chance to implement that for a large utility organization, I'm super grateful and look forward to learning people like you, Eric, and there are many others. I know there was a gentleman in the chat that said he worked on developing the 45003 standard. I know there's some origination to Canada and whatnot. So I think that's I'm super happy about the future, and events like this really kind of amplifies that message to a larger audience.
I love it. And maybe one final question: how did you get started on your journey?
Yeah, my journey. So again, I'm repeating myself a lot, but started with the leadership commitment, right? So we were asked, I'll kind of walk you through the timeline. We were asked to start implementing it. In our case, it's the ISO 45001 standard, obviously building on top of the 45001 standard. So we have an HR leader that uses the quote, "People are our business." So that's kind of a foundational statement from him. And then the first thing we did is we did a gap assessment. So, I think you talked about COVID, and I know COVID is like a PTSD, right? So we learned a lot in COVID. There's like agility and flexibility. And a lot of the things that the standard requires or PHS requires, we're already doing, at least my organization is, and I know other organizations are. So doing that gap assessment kind of gave us a picture and a roadmap of where we are. And then we partnered up with, I know not with you, but we've partnered up with somebody who's the academic behind it to kind of guide us through that and fill the gaps. For example, like right now we're working on risk assessment, like building up our risk assessment to identify those 83 psychosocial risks, and basically having assigned a criteria against them, and then put controls in place. There's a PHS, HOC, I call it, and then manage those in a systemic framework way. So having that gap assessment, having a trusted advisor or consultant who can guide you through the process, having the roadmap to get stakeholder engagement internally. And it's a journey. It's never going to be a destination. If we arrive to a destination, we have to continually keep improving. And then I guess the takeaway message is really getting the buy-in from leadership and other stakeholders.
Yeah.
And for me personally, and not everybody is the same, I was at a point where I didn't know the difference between psychological safety and psychological health and safety. So, aha moments like that, and having been partnered with people who've done this work, whether if it was the 45003 standard creation or the work that you're doing, it's very, very valuable.
Perfect. Thank you. There's so much amazing stuff that you said there, but I do want to also make clear there's so many ways to undertake psychological health and safety. You really have gone all in with implementing the ISO 45003, which is the international standard on psychological health and safety. It's a lot of work, but I think also it's maximum impact, right? Once you go through that process, and especially if you already have the framework for that and you're certified or you've implemented 45001, right? So, Ergun, I can't wait to see where this takes you. So hopefully we can follow up with you in a few months and see kind of how you're starting to see impact based on some of the work that you've done.
Absolutely. I'm excited, Olga. Thank you so much.
Thank you. And Eric, I don't know if you have maybe a question for Ergun before we move forward, or any thoughts?
Not necessarily a question for Ergun. I really appreciate it. And I love the fact that you're taking these, what some people think of as kind of esoteric concepts. That's great information, but then how do I apply it? How do I take this information and drive KPIs with it? And I love that you've done with that. Love that you've done that. Somebody asked in the question box, which kind of segues into one of my questions, which is, how do you explain PHS to an HSE person at a small company whose usual level of understanding stops at the obvious? For example, hand safety requires gloves. And I would take that to the next level, Olga, which is, we talked about making a business case for it. But what is the business case for the bean counters who, I hate to say that, but there are people within organization that look at, how is this a good ROI for us? And Ergun, thank you so much again.
Thank you both. Appreciate it.
First of all, I love the term bean counters. I'm going to definitely use that again. But just to give you, we are often, obviously within safety teams, we've got the KPIs, but sometimes we have to make a case to leadership to unlock our time to do this type of work, and to unlock, in some cases, a budget to do this type of work, right? How do we make that case? So I spent the last year really looking at where mental health costs show up in your organization, right? And where we're at right now, we'll release a study next year, but it's about $10,000 per employee per year. And I know this number sounds high, but I'll explain to you very quickly as to how we got there, right? So if you want to do the math, take down $10,000 and times it by the number of staff on your team or on your organization, and you will get the total cost of mental health, right? And we costed it at three stages. One is the preventative investments, right? So this is money going into things like benefits, mental health training, psychological health and safety assessments, right? As I'll show you, this is the lowest cost driver right now. And then we have early intervention, and this is where people start to progress in some of their mental health challenges or kind of early stages of mental illness. So whether that's stress, burnout, disengagement, accidents show up here when it comes to costing. And then the most expensive stage is something called crisis and exit. So this is now the stage that is associated with more serious mental illnesses, where people start to leave work and go on disability leave. And often they won't go once, they'll go back and forth, and they'll kind of circle in and out of an organizations where you have people leaving the organization. And I'm going to kind of run through this very quickly, but this is how costs manifest in each and every one of these levels, right? So The lowest amount right now is going to the prevention. The highest is going to this kind of reactive stage and this is a small number of people at your organizations, but they are expensive. And what we know about mental health and mental illness is that if you provide early intervention, you can actually prevent somebody from really going into, or from that evolving into a more serious issue, and then obviously prevent them from leaving the workplace. The one thing I really want to emphasize here is that today only 10% of mental health spend is going towards prevention, right? And that includes psychological health and safety. And I am almost sure, and we are going to be testing this over the next few months, is that if we just put more into the preventative bucket, and that includes psychological health and safety, because your work environment has to be healthy for your people, those other costs are going to go down significantly, and your total cost is going to go down significantly. I'm not going to get into this data too much, but maybe just very quickly before we kind of move on to the last section, I just want to see if you're seeing any of these costs show up in your organization. And then I'll just spend 5 minutes telling you what you can do about it, and we'll go on to the Q&A because I know there's probably tons of questions. What are you saying, Eric?
Yep. All over the map. All turnover, all
Okay.
accidents, sick days, things like that. So, yeah, and I'll tell you, as they're rolling in with these answers, Olga, you really hit on some key things from the prevention standpoint. You're speaking our language in safety. It's kind of like somebody brought up in the chat, ergonomics. I love going into facilities. I was like, well, let me see your ergonomics prevention program. I said, oh, we got a great ergonomics prevention program. When somebody gets hurt, when somebody has a cumulative trauma disorder, this is what we do. That's not prevention. That's after the fact. And it's the same concept that can apply to PHS.
Yep, absolutely. All right. Well, maybe just going on. Yeah, sorry, Eric, go ahead.
No, you're fine. It looks like we're all over the map with it, Olga.
Okay.
So great information, but how do we get started with this stuff?
What do we do? Okay, so we're going to provide you with 3 very kind of low-hanging fruit, simple things that you can do. The first is really to educate yourself, right? I'm just giving you the very high level. We haven't even gotten into ISO 45003, right? We are running a 2-day course in October, Eric and I, in North Carolina, and we will get much deeper into not only PHS and the process and how to do it. And by the way, you can do it yourself. You don't need expensive consultants coming in and doing all the work. If you want to start light, there are things that you can start to do kind of immediately, right? So we'll teach you about the process, how to design and implement. We'll teach you how to get buy-in from leadership, all the things that we really talked about today. And we'll also show you how you can leverage PHS to really future-proof your career. So that's the first thing, is to really dive more deeply into this and become an expert. There's also an online course that Eric and NASP launched. So if you can't, for any reason, make it physically to this 2-day workshop, definitely check out the online course. We will have, by the way, a QR code at the end. The other thing you want to do is educate your team, right? You want people to understand the repercussions right now of not addressing psychological health and safety, not only on their employees, but on their business outcomes. And I mean, some magic happens when we get people into the room, right? Not only will they know the basics, but they'll know why this topic matters. And also their role in supporting implementation. And this is so critical, by the way, because you want to have more people buying into this. You want to have more people supporting you in this. And often the minute we get this in front of the right people, there's so much excitement around psychological health and safety. So then if you as a safety leader want to do anything in the future around this topic, you'll already have a team that's willing to support you in rolling out an assessment or in doing something else. Now, the other thing I'll say very quickly is when we do these workshops, we also do kind of mini assessments. As I'm chatting to your team, I will start to already assess what some psychosocial hazards are that could be impacting your mental health and well-being of your work. And I'll do this several times. So by the time we're done this training, we already have an idea on where it is that you can start, or already have the foundation for you to do a longer assessment. Now, the eventually, and I would probably do this sequentially in this order, you want to assess psychosocial hazards, right? So to undertake a diagnostic, and then you'll really understand what these hazards are. You'll figure out which ones are most impacting your people, but more importantly, and Ergun talked about this, every hazard has a solution, right? And sometimes I see organizations doing these assessments and not having a clue as to what to do. And this is really where you want to bring in somebody externally, is you want to have a plan, a very clear plan, not only on what you need to address, but how to move that forward, right? And what resources you need. So that's why we really recommend as a next step, once you have that knowledge, to move towards assessing psychosocial hazards. All right, the one thing I'll say before we turn it over to Q&A is it does not need to be expensive or complicated, right? A lot of this stuff, if you have the education, you can start to do yourself, right? And there's a lot of guidance out there. There's, you know, an international standard. There's lots of great ways, but please just start to some extent to really move and push this forward because of the impact that we talked about that this is our mental health is already having on businesses. I'm going to stop talking. That is a QR code, by the way, for the course that we're running in October. But I think we can move towards Q&A. So I'll pass it back over to you, Eric. I think we've got 10 minutes.
Yeah, I think that was a great presentation, Olga. Thank you so much. You know, of course, it's dipping that toe in because that is a 30,000-foot overview of PHS in 50 minutes. So thank you for insightful information. I'm going to turn it over to John. I know, Olga, the chat boxes have been blowing up, but I don't know, John, if you've been able to capture some of these more prevalent questions. I'm going to turn it over to my CIO with some of the questions for Olga.
Sure. One of the questions we had multiple times, just to get this one cleared out, is will we provide this slide deck for the attendees?
Absolutely. Yep. This is being recorded. We'll send that out to everybody that was here today, and please share it with your teams and review it when you got an opportunity. That's no problem.
All right. Let's see. How do you determine the metric for sick time being used for mental health? And the follow-up to that was with surveys?
Well, I'm assuming you're tracking sick days somewhere, right? The number of sick days in your team, in the organization. I mean, that is a powerful metric, by the way. What you don't know always is why people are taking those sick days, right? So you don't always have complete information. Some organizations have introduced mental health days. So when somebody calls in and takes a mental health day, then maybe they can track those. But that is a little bit of a hard metric to track. What we do know from the research is that 30 to 50% of sick days are somehow mental health related. So if you just track your sick days and then multiply that by 30 to 50%, right, then you should have a sense as to how that number is trending.
Okay. Next question is, my manager has a serious mental health problem / problems. How could someone report this?
Wait, is that from you to me, John? That hurts.
I'm sorry.
Yeah, I mean, I think this sounds like an HR issue at this stage, right? If it's been pretty consistent and if you don't think you can speak to your manager about this, and this is where I would love my co-founder to be on with me because she's an HR expert, but I mean, especially if it's significantly impacting your mental health or the mental health of others around you, I would maybe just try to have a discussion with HR and see what advice you get about how to navigate this.
Okay.
One quick follow-up, John, before you go to the next question on that, Olga. This is not exactly the same thing, but do you find, generally speaking, that people are using the employee assistance programs, and is it worth the money that companies are paying for it?
Yeah, that's a great question. So I'll tell you the utilization rates that we see right now. They're about 3 to 5% for EAPs, and that's for a number of reasons, right? Some people don't know about it. Some people don't find it useful. And an EAP is not a solution for long-term care either, right? So it gives you a few sessions and then you're supposed to resolve an issue, which is wonderful, right? So what I would do is spend a little bit of time seeing if it's worth your spend, because you're spending money on that. Do your employees want this, or can you allocate that money towards a healthcare spending account, or I don't know, mental health training or something else that they really want? that will more effectively benefit their mental health and well-being. For some people, it works great. For others, it just might not make sense. But make sure you promote it first and make sure that is not the problem before making any major changes.
Great advice.
This one is a little lengthy. I think it's important to acknowledge that there needs to be a middle place, as the business does need to do business. So while some accommodations for this make sense, how do we help not only the employer, but also the employee develop coping skills?
Oh, okay. Well, let me start off with maybe just thinking a little bit about the middle place, right? Like, and especially when it comes to mental health and well-being. And if I understood this comment correctly, but I think there's a way to support mental health and do business better, right? So I think actually by supporting mental health, you'll see kind of a difference in your KPIs. And a lot of clients we are working with definitely are seeing kind of results, right? But in terms of the coping skills, so often when we do training, we will do training across the entire organization. And as part of that training, we make sure that we answer a lot of very common problems that are coming up, both at leadership, right? Because it's not easy, let's face it, to be a leader. You are just up against so much and you're trying to figure out so much, but also employees, right? And I think as part of this dialogue, we're starting to really understand the dynamic kind of on both ends. And there are ways that you can learn. Eric called them soft skills. I'll call them, mental health skills. But there are a set of skills that you can develop to support coping, to support relationships within your workplace, right? And all of these things, I mean, they're not just soft stuff. They are really good for how somebody shows up and performs at work. So I hope that answers that particular question.
All right, we are coming up on the end of the hour, but I did want to get this one last question in before we wrap things up. What are you supposed to do with the information that you gather from a PHS survey? It may be good information,
yeah,
but what do you do with it?
Oh, I love that question. Okay, so if you think about kind of undertaking a PHS survey, what you're going to do is you're going to get a set of, hazards. And I always see hazards as problems that you have to solve within your organization. You identify what they are, you rank them based on their risk or potential impact they'll have within your organization. And every problem has a solution. So what you want to do is when you identify what those problems are, is to really think about what solutions might make sense, and then you want to test them, right? Because you think something might work and then you implement it and it doesn't have the intended impact. And always measure, because once you start to implement these solutions, you want to figure out what happens to some of your key indicators, right? Especially linked to some of these hazards. So it is essentially moving towards identification, towards implementation, and really kind of getting a really, succinct and powerful PHS program out of that assessment. And it doesn't have to be difficult. I promise you, we do this so much with organizations, right? There is a way really to kind of, keep it simple, keep it focused, and still have some incredible impact as a result.
Okay. Did you guys want to try and take one more question, or we're at the 2-minute mark here?
Yeah, let's do one more. Why not?
Okay. You mentioned drug and alcohol use in the workplace. How do you gather information about use or abuse and still protect employees' right to privacy?
Oh, that's a good one. But in some cases, you can get that data from EAP providers. Now, not individually, but sometimes in terms of aggregate data. So that could be one way in which you get that information, start to see if there's some trends around whether that's going up or down. And then really, if you do see that it's going up, really make sure that the way that you're offering your benefits, the mental health portion of your benefits, really supports recovery around alcohol and addiction issues.
This one is a really good one. We have an EAP, but few use it. If PHS is such an issue, why don't employees use the resources that are provided?
Yeah, so I think this is back to kind of what I said earlier to Eric. It's not uncommon for people not to use EAPs, but we have to figure out why. Do they not know about it? Do they not think it's useful? Are they, using something else within your benefits? You really need to figure out the why they're not using it, and then figure out whether it's worth you still investing into that mental health support. But I just want to kind of maybe end on one note. what drives me really crazy sometimes is when I hear from organizations, our mental health strategy is our EAP program. That is not the case, right? It is a small part of a mental health approach or psychological health and safety program. So it's great to have it, if you can, and if your employees find it useful, but there are more things that you have to do which are complementary that really make the difference.
All right.
Yeah, thanks for these great questions.
Yeah, that's excellent, excellent information. And we'll wrap it up with a couple of comments on the EAPs that employees still fear retaliation for using an EAP. And there's also the stigma, especially in men. We don't want to tell our problems. We'd rather drink a beer and keep it down and not share with others, because that's not what we've been programmed, at least in the past, to do. And I see that a lot, especially construction, military, some of the government sites that we work on. That's just kind of an issue for us. Olga, I really appreciate the information. We're coming up at 2 o'clock now, so thank you so much for sharing so much information in such a little short period of time. Folks, we will be sending you the audio of this, and again, review it and reach out to us. We'd love to see you in that 2-day class. For those of you guys that don't know anything about NASP, our courses are very dynamic, interactive. It's going to be a lot of case scenarios using this information and applying it to your facility. So hopefully you'll get enough information to go back and implement a strong, healthy PHS program. And again, thank you to Eric for sharing his journey with PHS. That's where the rubber hits the road.
Absolutely. Thank you, Eric.
Olga, any final words before we go?
I just want to say thank you to you and the audience for being so engaged, for showing up. And we can't wait to see where this journey takes us in the future.
Excellent. Folks, have a great day and stay in touch.